Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio Dr. Theresa Nwachukwu. You're welcome to the studio.
Thank you very much, Father.
Good. Dr. Theresa Nwachukwu is an epidemiologist. She is the deputy state epidemiologist for FCT. Yeah, FCT is a state, right? Yeah, so for FCT, yes, it's treated like a state.
Treated like kind of.
And yeah, so as the deputy state epidemiologist, what do you do in your department, epidemiology department? What do you do? We don't see you every day. So what do you do?
So epidemiology is one of the departments, or is one of the divisions in the public health department. Okay. So we work in the public health space, and as the name says, epidemiologists, we deal with epidemics. Okay. So our role is to, first of all, promote health in the communities, and then prevent epidemics from taking place in the first instance.
Okay. So one of the services you are rendering for us is to prevent epidemics. Though you didn't prevent COVID, but okay. Yes.
Is to prevent epidemics, is to then if epidemics do happen, if there's an outbreak in the community, identify it, detect it on time, intervene, and ensure that you break it, you circle it out, break it, and control it.
Isolate it
and control it immediately to prevent it from going further. So it's a part of public health. So that's the space we work in. And
so Dr. Nwachukwu, you're a public health specialist, right?
I am a public health specialist.
Okay.
Yes.
But after practicing, after being a clinician for a number of years,
right,
you became a public health specialist.
Right. So I had worked for many years with patients, so one-on-one on patients, which is what clinical practice is all about. But then I also felt I needed to explore my potential. I also needed to explore other fields of interest, and public health really appealed to me because it can be quite frustrating when you treat patients and you send them back into the same community where they're coming from, the same environment that caused the diarrhea, the same environment that caused meningitis. And so my interest was, is there any way I could be a part of the solution of preventing these things from happening in the first instance? So when I asked myself those questions, the obvious solution was to go into public health, and I delved into that.
So are you able to say now that since you got into public health, you have been preventing a lot of the diseases that used to bring people to the clinic?
I would say that I've contributed to doing that. We may never be able to prevent 100%, but for those we have touched, for that one person, it's 100%. So yes, we've done a lot in terms of promoting, in terms of the programs that the government brings out, supporting them, advocacy, trainings, teaching, creating awareness about illnesses. For instance, in anticipating the rainy seasons, we know that some of the diseases we could have would be cholera. So to anticipate this, we have started advocacy, going into communities, especially those communities that had the major problems last year. Of course, a lot of interventions have happened between then. So to preempt them, to preposition things, as I speak to you with the support of WHO, we've even prepositioned materials for response to cholera. So what I'm saying is, yes, I think we are doing a lot to prevent.
Can we now, for the sake of our viewers then, can you now tell us the various things that your Department of Public Health, what you do? First of all, a lot of people in this country don't even feel what public health does for them.
Right.
So what do you do in the Public Health Department of Ministry of Health?
Okay.
What do you guys do there?
Okay.
That are of benefit to us?
Okay. Thank you very much. So in the public health department, the community is our patients. So what do? We prevent illnesses. So we do a lot of studies in terms of what are the prevalent illnesses in particular communities. Once we know what are the prevalent illnesses, for instance, I just talked about cholera, I talked about Lassa, I talked about meningitis. What we would do in those communities is to go into those communities and create awareness. So we talk to community, we have meetings with the community members and see, why is your community like this? Why don't you have toilets? There's a lot of open defecation. In the last year alone, over 100 boreholes have been installed in areas of high burdens of cholera to ensure that the next outbreak doesn't happen. So education, health promotion, what does that mean? Educating people, what causes diabetes, what causes hypertension. So we have different departments for all of these things, non-communicable diseases. So these departments or these or divisions educate the population, okay, about these diseases. Then train people on how to prevent. So we're training community members, we're training key informants about this. And then we're collecting information. So for instance, if something happens in your community right now, we have a system that gets that information to us within possibly 24 to 48 hours. Let me give you a typical example. If somebody with Lassa fever enters the FCT,
yes,
and travels,
and mixes
millions
stuff.
of people, yes, are in the FCT. They come in from different places. If somebody who has Lassa fever enters and has been diagnosed somewhere,
yes,
maybe escapes and enters the city, I can tell you that within 24 hours, that person will be picked up. That is how sensitive.
That person will be picked up because he or she was already diagnosed.
That person will be picked up because there's a system that reports, that tracks people, that tracks who comes in terms of epidemic surveillance.
No, in a country where we do not have everybody's identity, is not we don't have a data bank for everybody. That's why I'm interested in how would you track such a person.
Okay, let me tell you how that would happen. Okay, let me paint a scenario. We get somebody in the FCT who we take into the hospital, treat, and investigate, and say, this person, oh, you have Lassa fever.
Yes.
We need to manage you. And then we're managing, and somebody moves the person out. Maybe in the night, they sneak out of the hospital. Because you have, this person is in your system, you have addresses, you have contacts, you have phone numbers, you have people that you have taken note of. If they move to Nasarawa State, within hours, Nasarawa State epidemiologists and the team, they would pick up this person.
If it doesn't go to hospital?
The addresses, their phone numbers, they'll be tracked. We do this all the time. So what this means is that if something happens at the community level, it gets to, we have community informants. It's very well structured. That is what many people might not know. Somebody there informs there's somebody that we call the DSN, or the Disease Surveillance and Notification Officer. The DSN
there is a Disease Surveillance and Notification Officer
in every area council. We have them. These DSNOs work with community informants, facility. So in every hospital, there's also a focal person.
So there's Disease Surveillance, and he's working like a SSS now. The person is working like DSS.
Well, for the purpose of disease detection.
Yes.
Because we call it Epidemic Intelligence, disease intelligence. So basically, we have that system. And every hospital or every health facility, well, all government health facilities, I can guarantee that, then they have what we call the focal persons. So we work with these focal persons. So if somebody comes in to the facility and they have meningitis, they have yellow fever, they have Lassa fever, they have any of these illnesses, the clinicians are trained. They will inform the focal person in that facility. Say at Sokoro Hospital, for instance, Nyanya Hospital. The focal person immediately notifies the DSNO. The DSNO goes there, takes the details, their tools and their strategies. So they uses the tools, gets this person into the system, logs it in and reports. And sometimes even with a text message, we get it at the state. And at the state, I mean at the FCT level. We go in there, we get this information, and that is how. So when people say, when WHO, for instance, says in Nigeria, so many women have died from this, people question, how do these things happen? I didn't know this. I questioned this data until I started working in public health, and then I see how this data is generated.
Well,
so,
my own problem when I question some of that data is that when you say, especially when you use percentage of things, it presupposes that you have an idea of the total number. A country that none of us can say for sure how many we are. We cannot say for sure how many we are in FCT. So if you now say 10% of women in FCT, you are basing your projection on what base number? On what is the base? That's why some of us question some of that data.
That data.
So for me, we really need to work hard on having base numbers
Right.
to know the number of children that were born in FCT yesterday.
Right.
Which we don't know. We don't know because not everybody
Because
goes to
not
hospital.
everybody, yes, that's right.
We don't know.
I totally agree
We don't
with
know the number of people who died in FCT yesterday. We don't know. I mean, in the civilized world, these are taken for granted.
Right.
So we still have serious issues, and it is affecting the projections you now make afterwards. So for me, one of the dimensions of public health that really need to be pursued in this country is data.
Right.
Is accurate data, population, and then disaggregating that population in various ways. Now, you mentioned WHO, you mentioned this. It occurs to me that when it comes to these interventions, many of these cases, unless WHO, World Bank, any of these agencies, unless they intervene with money, we are not able to help ourselves.
Father, I don't think I'll be able to go into that in terms of if we don't help ourselves. I think in most response, and anywhere in the world, you bring your own, and then somebody else brings their own. Sometimes what you bring may not be money. You could bring the manpower, you could bring the knowledge, you could bring the materials, you could bring your facilities. If you hold a meeting in my facility and you don't have to go pay for a facility and you're holding in my facility, that's my contribution. So I agree. I see what you mean.
I am actually worried. I'm actually, because you see, as you started speaking, I began to hear about World Bank this, WHO this, and I'm saying to myself, because I'm familiar with these things, and I'm saying to myself, so if World Bank doesn't intervene, we cannot check, monitor, and do this track these epidemics in our society. And I am aware that really, if they don't intervene, we're not able to do it. And it's a shame, really. It's really a shame. I know you are a government official, but I mean, I'm not a government official, so I can talk about it. The truth is that in the 21st century, a country as endowed as Nigeria, that I am aware that a lot of epidemics, a lot of disease issues, that if these agencies from outside don't intervene, we are not able to help. Okay, we refuse to help ourselves. I won't say we're not able to. We refuse to help ourselves, and it is a shame, really. And what is leadership about if we are not able to do, if we're not willing to do these things? I refuse to say we are not able. Right. I believe we are able to. And I believe we have our priorities wrong. They say, for example, if you, no matter how secured you make your house, but the mosquito that bites somebody who is very poor next door and is carrying malaria will fly to your house. Your burglary proof will not stop the mosquito. You know.
I agree with you. I think. Well, remember that what WHO does in most countries, basically what they give a lot is technical support. WHO is really good at that, and in fact, I totally agree that they've done a lot to support the health systems in many countries, including Nigeria. But a lot of the work is still done by Nigerians. A lot of the work is still done. The system, for instance, let's talk about even getting the numbers out. From the community informant, it's the local person who is there giving that information to the health facility, which is supported by states, by the government, and then who is giving that information up to the state, and then we give the information. Because WHO can't come in here to do anything without the state. In fact, they will tell you that their rule is they can't come into the state without doing anything without us. So the data they get, the information they get, has to generate from the owners of that information. They would tell you, they'll be the first to tell you, oh, it's FCT project, it's FCT at the forefront, it's FCT, is the state, wherever that state is, we are just supporting. They'll be the first to tell you that. But I do agree that we could do more, and
we could do a lot more. I mean, and my own orientation is that we could do a lot more, and that Nigerians demand too little of their leaders. That's my position. We demand too little of our leaders. I think that this country this country is being run down because Nigerians, we are too compromising with our leaders. Otherwise, few people will aspire to leadership in a country like this, because the problems are so many that if indeed we were
really
demanding,
to be a leader,
if indeed we were demanding what we should be demanding of our leaders, few among those who are hanging around the corridor of power would actually dare to say they want to be leader, because the problems are so enormous. Is it in the health area? Is it in the education area? Is it in the environment area?
Absolutely.
Is it in the infrastructure area? The problems are so enormous that who are you to want to lead? You know, but because if it is to go and chop, of course, everybody wants to go and chop. But if it was to go and serve, I mean, you yourself can see in the area of public health, and the person in education will narrate the whole problems, and the person in environment, in transportation, and so on and so forth. The problems are enormous. The point I'm making is that there should be no apologies. We need to.
Yeah, I think I totally agree with you. I think to make things better, if we were a little bit more demanding of ourselves, of what we are capable of doing, if we trusted more that we deserve better, we could have better, I think every one of us would rise up to actually be more proactive in
the issue of that we deserve better.
Yes.
What I'm beginning to witness is that those who really believe they deserve better now are leaving the country, are giving up. And the leaders they don't seem to be aware that some of our brightest people are leaving the country because they believe they deserve better, and they have looked at those who are in the corridors of power and they have said, my future, I cannot give my future into the hands of these people. So they are leaving.
Right.
And those of us who are stuck here needs to begin to say, no, I deserve better. I deserve better roads. I deserve better quality.
But I don't want to say we're stuck here. I want to believe that we're not stuck.
We have
chosen.
Yeah, we have chosen. No. But what I mean when I say I'm stuck here is that I had every opportunity to be outside.
Right.
But I chose to be here.
Absolutely.
And my people are here. I can't abandon my people to go. That's what I mean by I'm stuck.
Yeah, okay.
I have a stake. I am not like a governor who finishes governorship one day, he handed over, and that very day he wants to check out of the country. Those people have no stakes in this country.
Right.
I can't just go like that. See the number of programs I run every week, and so can I just leave? I am too involved in the Nigerian affairs. I'm too invested. I'm too involved to just leave. Yeah. That's what I mean by I'm stuck. Yeah. So those of us who are invested heavily in this country, we need to keep asking for more. We need to say, look, imagine if World Health Organization or any other organization does not bring us any money, are we not going to do this ourselves? I looked at was it last year's budget? And I looked at Ministry of Health got what, 48 billion. It's shameful. Yeah. It is shameful. And then you see what is spent for governance. We have decided to establish numerous departments, numerous this with chief executives that end up spending everything on overhead and nothing for actual development or implementation and so on and so forth. That's what we all need to cry about, to say this is not how to run a society. Some of the things that your group they are concerned with are things that have been taken care of in other societies. I mean, and they run seamlessly, digitally,
I totally agree with you, because last year when we had the outbreak of cholera, it was really embarrassing to talk about cholera in Nigeria and in FCT, the capital, you know. And that is happening because there's still a huge number of people that are doing open defecation. People don't have toilets. People build houses and there are no toilets. So that is, it should be absolutely unacceptable in any environment. So, like I said, we need to. I think we're just used to anything goes. We're just used to.
No, we have. And part of our problem is
not thinking well enough of ourselves. The dignity that we have to say this shouldn't be happening.
Part of it is our ethnic and religious divide. Our ethnic and religious divide have put us in a very vulnerable situation where it is not easy for me to rally around everybody, Muslim and Christian, Northerners and Southerners, to say, let's fight this thing. Immediately people start going to your tent, so Israel. Oh, it's our church member. Oh, it's my tribe member, and so on and so forth. And we cannot win with that. We can never win. Societies that have experienced major transformation, people have come together.
Across boundaries,
people have come together.
Bonds, yeah.
But as long as we are as divided as we are, and we think we can make progress, don't they say traditional wisdom, united we stand, divided we fall? So that's a major problem.
I totally agree with you. Yeah, these are some of the things that we're seeing, that divide, that tendency that when something happens, if that person is from your place, then it's okay, or you don't want to speak about it, or if you speak, they say, why are you speaking? Don't you know it's your townsperson? Why are you talking about this? Don't you know? Just keep quiet. It's your townsperson, So, or your tribal person, or your religious, your church member. You shouldn't say anything, We need to, and I think is just that foundation that we have. Because sometimes when I hear people say, our generation 20 years ago it was better, what is the benefit of all of that to the generation? What have we brought forward? If we're saying, it was better in those days, we had the best education, with 100 naira you could buy a car, so you had everything. You could go to England with 300 naira and all of that. What did you learn? How did we come to this point? So one would have expected that with all of the good foundation that we talk about that was led by older people, that what we're handing over to the generations now would be better. But you don't see that translation. You don't see that stepping down of all the great things that we talk about in those days.
I mean, we're a country that keeps looking back. It was better in the 60s. Right. It was better in the 50s.
Right.
Whereas other societies have moved on. I mean, other societies have moved. Singapore definitely is not the way it was in the 60s. Singapore was not better than Nigeria in the 60s. So how come that we have been... Okay, some places even had military rule. Singapore had some kind of dictatorship. The dictatorship was a benevolent dictatorship. It was a dictatorship that had a common
military rule.
It was dictatorship that had the common good at heart.
Right. Okay.
So Lee Kuan Yew used his dictatorship to make the people do things for Singapore.
Right.
He didn't use the dictatorship to enrich himself.
Self-enrichment.
So our own kind of dictatorship was one that we are still counting Abacha loot till today. We're still counting. So our own kind of dictatorship is one of just self-enrichment, self-aggrandizement, and same thing with our own kind of democracy. Now we are having democracy. Yeah. But the democracy doesn't appear to be helping the common man on the street. The common man on the street, his lot or her lot is getting worse by the day. So Nigerians really need to sit up and look at one another as fellow sufferers under the Nigerian ugly system and work towards a better system, so that qualified people like you can have the tools you need to work and improve the country in every. We shouldn't be talking of cholera today in the 21st century. Shouldn't be talking of Lassa fever outbreak today.
I know, but that's where we find ourselves, and we hope that things change. We hope that with the coming elections, we hope that we can get leadership that we deserve. I think that's what everybody wants, whether you're in the government or you're in the private sector. We just want the kind of leaders that we deserve, that we should work for. Leaders that will work for us. And I am hoping that we will see changes. I think the awareness is better now. The conversation, when you hear Nigerians speak, it is very, the despondency, the fact that nothing positive seems to be coming out from any angle is just very heartbreaking.
Very depressing. Yes, I mean, and that goes to reinforce our sense of helplessness,
Yeah.
Well, on this note, I'll be bringing this discussion to an end. I've been speaking with Dr. Theresa Nwachukwu, an epidemiologist, with the Ministry of Health, the Public Health Department of FCT, and we've been discussing issues of public health and particularly epidemiology, how they track diseases and how they track epidemics and try to prevent it and its spread and so on and so forth. We will need to sit again to discuss further on this wonderful work that you do. God bless you.
Thank you very much, Father, for inviting me.